Homelessness by Caitlin Atwood. During this presentation, we will explore multiple topics related to homelessness, including defining homelessness, the history of homelessness, crimes committed by the homeless, crimes committed against the homeless, legislative change to address homelessness, and what we can do to address homelessness. What is homelessness? There are varying definitions specific to the characteristics that the definition is meant to address. The Health and Human Services Department of the United States defines homelessness as an individual who lacks housing without regard to whether the individual is a member of a family, including an individual whose primary residence during the night is a supervised public or private facility that provides temporary living accommodations, and an individual who is in a residential transitional house. The United States Department of Housing and Urban Development redefined homelessness in 2016. The first section includes an individual who lives in a place not meant for human habitation, a safe haven, or an emergency shelter. Individuals must have been homeless for 12 months or on 4 separate occasions within the previous 3 years, cumulatively totaling 12 months. Diagnosis of the following can be coupled with housing circumstances: substance use disorders, serious mental illness, developmental disability, post-traumatic stress disorder, cognitive impairments resulting from brain injury, or chronic physical illness or disability. The second section includes an individual who has been residing in an institutional care facility for fewer than 90 days and met all the criteria within the first section before entering that facility. Institutional care facilities include jails, substance abuse or mental health treatment facilities, hospitals, or other similar facilities. The third section includes a family with whom the head of household meets the first section criteria. For children, homelessness is defined as individuals who lack fixed, regular, and adequate nighttime residence. Exploring the definition of homelessness, it is evident there are multiple definitions. Housing is a central point of the definition. Poverty paired with a lack of stable housing are key points. Children, seniors, veterans, and single adults are all different subcategories within the definition of homelessness. Length of time also plays a role into the resources available to these individuals. Factors that contribute to homelessness can vary and can include the following: poor health with an inability to provide income sufficient to afford housing. When an individual is sick and is unable to provide income for themselves, additionally is unable to recover from symptoms due to lack of housing, the circumstances can greatly contribute to the length of homelessness. Living on the streets also puts individuals at risk of contracting diseases, being victim to violence, and unable to feel secure. Studies show that once housing is available, these individuals are able to start recovering both physically and emotionally. There is a history of homelessness globally. This section will focus on the emergence of homelessness in the United States and how it changed over many years. In 1870, the United States started calling homeless people tramps, which were individuals who would take the National Railroad system in search of jobs. Jacob Rills, a photojournalist, was able to depict the lives of American tramps within the United States. He called himself a member of the Great Army of Tramps who looked for work across the country. These individuals were largely young, able-bodied white men who created a culture of loving the open road and distaste for industrialized work within America. Francis Wayland, who was the dean of Yale Law School in 1877, saw these homeless tramps differently. He stated, "As we uttered the word tramp, there arises straightway before us the spectacle of lazy, shiftless, sauntering or swaggering, ill-conditioned, irreclaimable, incorrigible, cowardly, utterly depraved savage." During World War II, the demographic who were considered homeless continued to be largely a white male population, though their age was increasing to a demographic of over 50 years old. These individuals were often disabled, dependent on welfare or Social Security, lived in cheap hotels, flop houses, or single-room occupancy hotels within poor neighborhoods in urban America. Under HUD's current definition, many of these individuals who lived in single-occupancy hotels were considered housed. In the 1980s, homelessness started to change into the modern era of homelessness. We started to see gentrification in inner cities, deinstitutionalization of mentally ill, high rates of unemployment, the emergence of AIDS and HIV, inadequate supply of affordable housing, there were deep budget cuts to both the United States Department of Housing and Urban Development and Social Security agencies. We saw the Great Depression, and in addition, single-room occupancy hotels were converted to apartments and condos, and we saw rent increases without wage increases. The deinstitutionalization of mentally ill individuals is a large contributing factor to homelessness even today. In 1960, the number of patients who lived in state hospitals was 535,000. In 1980, the number of patients dropped drastically to 137,000. Specific to California, the state hospital beds were decreased from 37,000 in 1955 to 2,500 in 1983. Community-based services were inadequate to aid these numbers of individuals, and those who were previously institutionalized or those who would have gone to institutions often ended up on the streets or in temporary shelters. In 1984, Jonathan Alter of Newsweek reported the released mental health population was now a large portion of the homeless population. What was previously a demographic filled up of alcoholic individuals and older white males increased to thousands of women and individuals who were mentally ill and not being treated. He stated that few were dangerous to anyone but themselves. The incidence of crimes that are committed by the homeless was the original thesis behind this presentation. The research showed that fewer crimes are committed by the homeless than against the homeless. Crimes that the homeless commit are often nuisance offenses. These include panhandling and jumping the subway. Once legislation passed against the nuisance offenses, such as anti-panhandling laws, these individuals are found more likely to commit more serious crimes. The more serious crimes can include theft as well as breaking and entering. As found in the study conducted by Sean Fisher, psychology graduate of New York University in 2008, homeless people who go from shelter to shelter are more likely to commit violent crime than those who are living on the street. Stress is seen as a potential contributing factor towards the incidence of violent crime. Characterizing the homeless as being criminal would be inaccurate. Rather, these individuals are merely struggling to get by. As stated in the previous section, crimes against homeless are actually more prevalent than crimes committed by the homeless. We will explore this topic in more detail. The website nationalhomeless.org provides insight into the occurrence of violence against homeless individuals. The fact sheets show that within the last 15 years, there have been a reported 1,437 acts of violence committed against homeless individuals that have been reported. The homeless community has widely been criminalized in that there are laws surrounding anti-camping, anti-panhandling, and anti-food sharing. The occurrence of such correlates to the crime rates among the homeless as well as the victimization of these individuals. A study conducted by mental health professionals, including Dr. Lawrence Roy, reviewing criminal behavior and victimization among homeless individuals with severe mental illnesses, found that individuals working with the homeless should be aware of high levels of victimization that is experienced by these individuals. More findings from the study include the fact that there is very little insight into the victimization rates of these individuals. Incidence of violent victimization correlates to the criminal justice involvement of these individuals. The study also indicated the more quickly we are able to house those who are homeless, the less incidence of criminal justice system contact these individuals will have. Providing mental health and substance abuse services will also play an effective role in reducing any criminal behavior of homeless individuals. There are many agencies that provide assistance and resources to end homelessness. We will further explore how legislation has created and changed how these agencies have worked. The United States Department of Interagency Council on Homelessness coordinates federal response to homelessness. Through 19 federal agencies and partnerships, the goal of the Council is to prevent and end homelessness in America. The agency was reauthorized by Homelessness, Emergency Assistance and Rapid Transition to Housing, HERTH Act of 2009. The United States Department of Interagency Council on Homelessness partners include the following: Department of Health and Human Services, Department of Education, Department of Labor, Department of Housing and Urban Development, Department of Veterans Affairs, Department of Agriculture, Department of Commerce, Department of Defense, Department of Energy, Department of Homeland Security, Department of Interior, Department of Justice, Department of Transportation, Corporation for National and Community Service, General Services Administration, Office of Management and Budget, Social Security Administration, United States Postal Service, and White House Faith and Opportunity Initiative. The agency plans to increase affordable housing, strengthen prevention and diversion, create solutions for unsheltered homelessness, strategize for rural communities, aid in successful employment of previously homeless individuals, and listen and learn from those who have been homeless. What can we do to address homelessness? Becoming an advocate and raising your voice regarding these issues is a good step. Providing monetary and community-based support for the agencies that support homelessness is another good goal. Finally, a good way to address homelessness is to stay informed. If you or someone you know is homeless, contact 211 for further information on how to get help and support.